Tigecycline, also known as Tygacil, is a medication used to treat severe bacterial infections that may not respond to other antibiotics. It belongs to the tetracycline class of antibiotics and works by preventing the growth of bacteria. It is important to note that this medication only treats bacterial infections and will not be effective against viral infections like the common cold or flu. Using this antibiotic when it is not necessary can reduce its effectiveness for future infections. So, it should only be used as prescribed by a healthcare professional. Before using Tygacil Vial, make sure to read the patient information leaflet from your pharmacist. This medication is given by injection into a vein over 30 to 60 minutes by a healthcare professional, as directed by your doctor. If you are using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional. Remember to use this medication at the same times every day for the best effect. And continue to use it until the full prescribed amount is finished, even if symptoms disappear after a few days. And remember to tell your doctor if your condition lasts or gets worse. You may experience nausea, vomiting, headache, dizziness, or pain/swelling at the injection site. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects for most people. However, you should still tell your doctor right away if you experience any serious side effects such as signs of kidney problems, unusual fatigue, severe stomach/abdominal pain, hearing changes, irregular heartbeat, easy bleeding/bruising, yellowing of the eyes or skin, or dark urine. In rare cases, this medication may cause increased pressure around the brain, especially for women of childbearing age who are overweight or have had intracranial hypertension in the past. If you experience severe headaches, persistent nausea/vomiting, or vision changes, seek medical help immediately. Additionally, this medication may rarely cause a severe intestinal condition due to a bacteria called C. difficile. If you develop persistent diarrhea, abdominal or stomach pain/cramping, or blood/mucus in your stool, contact your doctor right away. Prolonged or repeated use of this medication may result in oral thrush or a new yeast infection. If you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms, contact your doctor. While a very serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. This medication has been linked to a higher risk of death, so it should only be considered when other treatments have not been effective. It's important to talk to your doctor about the risks and benefits of using this medication, and to explore other effective and potentially safer options for treating your infection. Before using Tygacil Vial, make sure to tell your doctor or pharmacist if you are allergic to it, tetracyclines, or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions. Also, let your doctor or pharmacist know about your medical history, especially if you have liver disease. Be cautious when using this medication, as it may make you dizzy. Avoid alcohol or marijuana, as they can increase dizziness. Do not drive or operate machinery until you can do so safely. Limit your alcohol intake and talk to your doctor if you are using marijuana. Tygacil Vial may affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are using this medication before getting any immunizations or vaccinations. This medication may also make you more sensitive to the sun, so limit your time outdoors and use sunscreen and protective clothing. Inform your doctor if you experience sunburn or skin redness. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you have children under 8 years old, be aware that they may be more sensitive to the side effects of Tygacil Vial, especially tooth discoloration. This has also been known to occur in older children and young adults, so discuss the risks and benefits with your doctor. If you are pregnant or planning to become pregnant, talk to your doctor about the risks and benefits of using this medication. It is not recommended to become pregnant while using Tygacil Vial, as it may harm an unborn baby. It is also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of how Tygacil Vial may interact with other medications you are taking. This can affect how well your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Tygacil Vial include retinoid medications taken by mouth, such as acitretin and isotretinoin. If someone takes too much Tygacil and has severe symptoms like fainting or difficulty breathing, call 911. Otherwise, call a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. It's important to remember not to share this medication with others. This medication has been prescribed specifically for your current condition, so it's crucial not to use it later for another infection unless your doctor advises you to do so. Your doctor may also want to conduct lab and/or medical tests while you are using this medication, such as liver function, fibrinogen levels, blood counts, and cultures. Be sure to keep all medical and lab appointments and consult your doctor for more details. Make sure to take Tygacil Vial as directed by your doctor. If you happen to miss a dose, make sure to speak with your doctor or pharmacist to figure out the next dosing schedule. Be sure to follow the storage instructions provided with the product and consult your pharmacist for more information. Keep all medications out of reach of children and pets. Do not dispose of medications in the toilet or sink unless instructed to do so. Properly discard this product and it is expired or no longer needed. Talk to your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.